On behalf of Hospice of the Piedmont, welcome to the E-Series, an educational webinar aimed at engaging our community, exploring relevant topics, and educating about ways to connect with our organization. Funding for the E-Series is provided by the Dr. John A. Lusk Fund for Hospice and Palliative Care Education. My name is Ryan Biagini, and I am your host. Today we begin our next installment of the E-Series with exploring our community, identifying health disparities, a conversation between CEO of Hospice of the Piedmont, Trent Cockerham, and Giselle Mansi, the new director of the YWCA's Latino Family Center. Trent joined Hospice of the Piedmont in 2013 as the organization's third CEO since its founding in 1981. He has 25 years in healthcare leadership. Most recently, he led the organization in navigating a successful merger with Hospice of Randolph. Thanks for being with us again today, Trent.
My pleasure, Ryan.
Giselle Mansi serves as the director of the YWCA's Latino Family Center. In this role, her goal is to guide and serve the Latino community in order to build bridges of understanding between racial and cultural divides. Additionally, she works to find common ground between other communities in order to strengthen the city to which she has called home for the past 15 years. As an immigrant herself, she understands the needs and challenges of the Latino community. Giselle has served in the Latino community in many capacities and finds joy in educating the community with resources and skills to be able to better help themselves. Thank you, Giselle, for taking the time to be with us today.
Thank you, Ryan.
Without any further ado, I hand the discussion over to you, Trent.
Perfect. Thank you, Ryan. Giselle, it's such a great pleasure to be with you today, and thank you for joining me as my guest for this installment of the E-Series. I think I'd like to begin with just a really broad statement that maybe will inform where our conversation goes. The Latino population makes up the largest and fastest growing minority group in the country. So I think this conversation couldn't be more timely with us today. So I appreciate your joining me. I'd be remiss, however, if we didn't begin our conversation with giving you an opportunity to tell our viewers and listeners a little bit about what the Latino Service Center does and what its purpose is.
Sure, absolutely. Well, Trent, first of all, thank you for having me, for being here with you and having this conversation, and for allowing me to share just a little bit of my community and just a little bit of what we do. As Ryan shared earlier, our Latino Center is, I kind of like to call it a little bit of a Google hub, if you will. We're located in High Point, and my number one goal is to help the Latino community with resources. And now I tell people that I kind of serve the Latino population, but I like to break it down into 3 different groups because I serve the youth. I have, children that migrated here, or even first gen, second gen. I also have my Latino immigrant community, but then I also have my Latino professional community. And between the 3, I help everybody, but my main thing is I want to make sure that my Latino immigrant community gets the help and the resources that they're looking for, that they're needing, that perhaps they don't know how to navigate. But then I also want to bridge, the Latino professional in making sure that, because a lot of them are either, they were immigrants themselves, they were able to kind of break every barrier and now have a career. And so now bringing them back and, just helping others to do the same. And obviously with my youth, leading them and guiding them through their, middle school, high school journey, and making sure that, we can look into college options, community college, career, entrepreneurship, whatever the case may be, guiding them in that process. Because many of those kids don't have, the parents don't have the resources and don't know how to navigate that part. And so at the YWCA, Latino Family Center, we take care of a range of different things. So we're there for the community. And my job is to make sure that the resources are out there in the language, but that they're also accessible.
Sure. I'm really struck by how you divide up your population of folks. You've got your youth, you've got your immigrants, and you've got your Latino professionals. And, I think there are a lot of people who might have this really stereotypical thought that that the entire Latino population is made up of sort of day laborers, right? And that's simply not true. I mean, that's part of what we're doing here today, is sort of shedding a light on who the Latino community is. But then, further on in our discussion, we'll have some conversation, more in-depth conversation about how health disparities actually affect them. So, I mean, that's really an interesting way that you sort of group the constituencies that you serve. And I suspect that they all have a shared experience, although each of them may have different needs. Is that fair?
Yes. I mean, we all have this collective shared belief experience, but the needs are very different, right? When it comes to and I'm gonna just kind of focus a little bit on my Latino immigrant and my Latino professional, right? I consider myself the Latino professional, right? I was an immigrant. I came in, didn't know the language. I came in as a child, grew up, had many barriers, many challenges, right? But I had to break through and fight through and make my way up, right, if you will. And so I consider myself, that part of the group. However, it doesn't mean that I don't relate to the immigrant community, right? Because I am an immigrant. My parents came here as immigrants, right? And the needs of a newly arrived immigrant are going to be very different from one of the Latino professional, right? And when I say Latino professional, it doesn't mean that they went to school and they have a degree. It could be that they have their own business, or whatever the case may be, they made a name for themselves. But then likewise with the Latino immigrant, you may be newly arrived and there's various levels or categories, right? You may have the undocumented immigrant, you might have the documented immigrant, but within that, right, you can have people that have still their own business or their own, ideas or what that they're trying to better themselves, right? And so I think every group, every category, we all have like the shared experience of, making sure that we know the language, that we're learning the language, or like navigating the culture, the area that you're in, right? North Carolina is very different. I grew up in Florida, right. Very different. I grew up in Miami, and very different, right? And so, and the collective population too, like in Miami, it's a melting pot and we have people from everywhere, right? And then if you go a little bit more up north here in North Carolina, our main population is probably from Mexico, right? So even when you start looking at where you're from individually from your country, that varies in how you deal with things.
Wow, fascinating. So our conversation today is really going to be centered around health. And there was an interesting article that was published in this week's New York Times. And the headline read something to the effect of what happens when people stop going to the doctor for a year. And then the subtext of that was, we're about to find out. 43% of preventative medicine visits were canceled in this last year. Obviously, we were coming off of a year of a pandemic or an ongoing pandemic. And nearly 2/3 of preventative health screenings, mammographies, colonoscopies, and cervical cancer screenings were canceled, all in the last 12 months. And more interestingly about that, however, is that the excess death rate among the Latino population, so the number of percentage of the Latino population that actually died, which is greater than what we expected, was 44.1%. It was about 18% for African American population, but 44.1%. And so let's sort of talk a little bit about sort of barriers to healthcare and how the Latino population, which is a minority population, but a fast-growing minority population who have really varying needs, how they navigate a healthcare system, and what are their needs and what's common among them, even for your youth, your immigrants, and then you've got your Latino professionals. I suspect they have a shared experience.
Correct. And just to kind of, share a little bit on like the statistics, right now, I think I read somewhere that we are 1 in 6 here in the United States. But they said that by 2050, we're projected to be 1 in 4. So we're going to be 25% of the population in the United States, which is huge, right?
Mhm.
But you just share a death rate, right? 44.1 was it percent,
44.1%.
which is alarming. Like, and I'm wondering, is that COVID related, or what the number represents? But regardless, it's alarming because we need to talk about, well, what's going on? Why is our death rate so high? And what are we facing? So one of the things that I tell people, one, just talking about the immediate ones, right? We have educational barriers. We have language barriers.
Mhm.
We have working barriers, right? And then the number one is accessibility. And when I say working barriers, right? We're all working. Like your Latino population, we're going to be working construction or in the fields, or like typically that's what you hear on TV, right?
Mhm.
We're going to be doing that hard manual labor. And typically a lot of those jobs don't come with benefits. They
Mhm.
don't give you health care, that you don't have these things that you suspect that your job is going to offer you, right? Um, Compared to somebody that maybe works in an office or in a corporation where you do have the health care or whatever. And so that is one limitation, right? Language. Can you communicate, right? Can you share what's going on? And then accessibility. Is it accessible in our own language? If we finally decide to go to the doctor, are we going to be able to communicate, right? But then as a collective, right? There's also this, I want to say, not a cloud, or like this vague idea that going to the doctor is a need that's almost luxurious if you talk
Oh.
if we talk about it, right? um for example, if you are uninsured, right, you're not going to go to the doctor to do preventative checks.
Mhm.
You're just going to let it sit and sit and sit until something is really wrong. And sometimes until you wait that something is really wrong, it's too late. Like now, like what could have been prevented, you didn't. So now we're running, and we have all these issues, and now our bill is going to be ginormous, right? Like you think about if you go to the emergency room or you go to the doctor, now you're going to get a bill that's going to be $5, $6, $7,000. And if you all of a sudden the doctor tells you you have to have surgery, you have to sit out, you can't go to work, and you're the main person that needs to provide for that family, you're thinking, no, I can't. I have to go to work, so, and I can't have the decision of, do I pay my medical bill or do I pay my bills?
Sure.
Right. And so it's one of those things where it's like really, it's very complex to navigate. Right. But then, and I'm just going to share like my experience
Sure.
quickly. Right. When I was a kid, when I was a child, um, we migrated. I'm originally from Argentina. We moved to Miami, Florida. My parents, they're like, we want to give you guys a better future, so we're doing this, right? And I remember growing up, we had to go to the doctor. But I remember my parents telling me, when you go to the doctor, right, if they ask you, how is your health? Do you have, X, Y, and Z? No, I feel great. Do you have this? No, I feel great. Make sure that you answer that everything is great, that everything is going well, right? So I grew up, if I had to go to the doctor, I grew up sitting down and saying, do you have headaches? No, I feel great, right? Does your stomach hurt? No, I feel great. And maybe it was hurting, but I had to say that everything was great, right? Because we could not afford to have, like follow-up checkups or buy the medicine or whatever it was, right? So I grew up like this. So then I become independent, do my life, go to the doctor for the very first time as an adult, right? And I remember I made up an appointment because I needed something, but I didn't know how to express it. So I go to the doctor, and they're like, oh, so hi, Giselle, how are you? I'm doing well, and they're like, okay, so we're going to go through, the initial checklist that they do. And they're like, oh, so do you, smoke? No. Do you drink? No. Well, do you have, migraines? No. Do you have this? No. Well, whatever. They ask me all these questions and I'm like, oh, I'm good. I'm good. I'm great. I'm great. I'm great. And finally the doctor's like, so why are you here? And I'm like, and in my head, I'm like, well, I have issues. Like I'm going through issues, but I couldn't communicate it, right? And so I kind of said that, right? Like, I'm like, well, I'm going through this, but I just gave them like 3 words, and they were like, so this is what you need to tell me. And finally, when I opened up, I almost felt like I violated some kind of trust between my parents and I. Like, all of a sudden, like, I felt vulnerable. Like, I'm like, who are you? Like, all of a sudden now you're looking into me and you're asking me more questions. And I'm like, oh, I was not ready for this, right? And so it was a huge mind shift, cultural phenomenon for me, where I went from like growing up saying like everything is fine, everything is fine. And then all of a sudden I'm like, wait, but I have more. I have migraines, or I have this, or is this normal? All of a sudden, like, I just bombarded the doctor with all these questions. And he was like, whoa, okay, one at a time, right? But and I thought I was the only one. Well, then I saw the same idea later on. I worked as an interpreter at one point, and I saw people doing the same thing. Like, they were at the doctor because they got hurt, or whatever the case it was. And they would sit with me and they will be like, oh yeah, I broke my arm, and I had to have like 10 stitches, and I have a rod, and it's been painful, and it bothers me, and at nighttime I can't sleep. The doctor walks in. So, Mr. So-and-so, how are you doing? Oh, I'm doing great. And I'm sitting there and I'm like, wait, you just told me that it hurts at nighttime, right? And so I don't want to violate that trust with the patient. So I'm just translating back and forth. And finally I tell the doctor, I'm like, would you give me just a minute? Like, I have a conversation. And so I'm telling, my patient, like, you really need to share what's going on, right? But their response was, but I don't have insurance. And if I share this, it's just going to be more appointments. And that means I have to take off of work. And that means that it's going to be another bill. And it means that it's just, all these different barriers. And so at that point, I'm like, your health is first. If you cannot take care of your health, you won't be able to work. You're not going to be able to provide for your family. So you need to share what really is going on. And once they were able to see that, and trust the fact, right, they were able to start sharing. But otherwise, they would have been like, oh, I'm doing fine, but they're dying in pain, right? And so I think it's just it's one, and it's not that we don't like going to the doctor. We do, because in our countries, we do go to the doctor.
Sure.
It's the accessibility piece
Yeah.
that's an issue, right? Like,
Right.
there's different barriers that we have to cross in order to go see a doctor.
Mm-hmm. And some of those, just what you've described, are really sort of hard-coded cultural barriers that exist within your own cultural group, right? I suspect it was probably liberating for you to realize that this was a shared experience for you, not an isolated experience for you, right?
I mean, I thought I was, like, it was just me, but then it was like multiple people. Like, I heard it over and over, and I see it over and over.
Right.
That they avoid going to the doctor. They wait until they can absolutely wait no more, that the issue is so unbearable. But
Right.
then, and then you also hear people say like, oh, you don't want to go to the emergency room because they're going to charge you this balloon amount
Sure.
of, but by then, because they didn't do any preventative, they have to end up in the emergency. And then you have this huge bill, right?
Mm-hmm.
Another short little experience. I had a student back in the day that the mom had a stroke. No one knew that it was a stroke. She did not call the ambulance. They found her on the floor, right? This happened at nighttime. It happened, and the kids were there,
Right.
but it happened. She did not wake anybody else. They found her on the floor. And when they found her, they're like, Mom, we're going to take you to the hospital. And she was like, no, I got to go to work. And they're like, Mom, we have to take you to the hospital. No, I'm going to be fine. She went to work. Half of her body was not functioning, but she went to work. She worked at a farm. And when she came back, it just got worse. And she was super against of going to the doctor because she was the main provider. She says, if I don't go to work, I won't be able to provide.
Yeah. So it sounds like we're sort of butting up against these, social determinants of well-being and health, right? These social considerations that actually affect 80% of health outcomes, right? Because I think we know from studies that only about 20% of health outcomes in a minority population in particular are really influenced by the medical system. 80% of it is happening just as you described, outside of an emergency department or outside of a hospital or within family groups, right? Perhaps even using sort of folk medicine, to use a term, right?
Right.
Things that they believe are the right things to do, that will get them to tomorrow or the next week, absent of any, conventional medical intervention, right?
Right.
And so, what you're talking about, it sounds like, are really social considerations in some way, shape, or form that really create a barrier before the barrier, right? So if we have an accessibility issue, we have to first get past the cultural issue. And so we have to first begin to create a shared understanding across our community, much like what we're hoping to do today by having this conversation.
Right.
Bringing light to things that we don't often think about, but have an ability to understand that exist within our communities. So how do we begin to really normalize these conversations? How do we begin to reach these populations, this fastest growing segment of the minority population in the country, in our own community? How do we begin to reach them to say, let's help you understand what you can access. Let's help you understand the importance of preventative medicine, but it's more than just preventative medicine. It's seeking the care you need at the time that you need it and on the terms that are really good for you. We talk about that a lot in our own organization, the care you need on the terms you choose. So how do we begin doing that?
Well, I think, Trent, you kind of hit the, the topic on the nail. We have to have these conversations, right? So part of, it doesn't matter what group we belong in, right? We have this cultural share idea that, because and male, and I didn't even talk about gender roles, males are even less likely to go to the doctor, right? They will say, I am fine, right? Now women, and I want to kind of retract a little bit. Like if we're pregnant, like you're going to go to the doctor, whether you're an immigrant or not. You have to take care of the baby. So that's going to be done, right? But in the back of our mind, it's going to be like that, the bill, all these things, the medicine, et cetera. For males, they're going to wait. I mean, they could be falling apart and they're just going to put it off until the last possible minute, right? And that's just across the board, period. And I'm not even talking about mental health. Like that's a whole other topic right there, right? Sure. But I think having, the conversation as a community is understanding that, yes, there are all these barriers and everything, but what, what different organizations are out there that we can partner up and say, hey, let's do, a conversation. Let's reach out to like the Latino population, let's have conversations in Spanish or have materials that are easy to read, because within, there's different levels, you have people with different education levels that are easy to read, that are understandable. Let's not use this huge language, right? And let's educate. It comes down to education. It comes down to even if you're friends with the Latino population, regardless of what group they belong to, I tell people, share your experience, right? Not from like, oh, well, I can go to the doctor and I did this or that, but say like, what? I was dealing with a migraine for days. I finally decided to go to the doctor, and gosh, I'm so glad that I went, because now I got some relief, or whatever the case may be. Sometimes you have to lead by example, right?
Yeah. And so it sounds like what you're talking about is really inspiring people within the Latino community to share their own experience in an effort to sort of begin to build trust. So there are two parts to that, right? We perhaps as an organization, as we begin working with you all at the Latino Family Center, we are beginning to understand what the needs are, right? That's one part of it. And then the other part of it is inspiring people within your own community to talk about their experience in an effort to build some common thoughts of trust, that you shouldn't be afraid that they're not going to judge you for your immigration status. They're not going to
Right.
judge you because you have a language deficit. They actually have resources to be able to help support you with that. And I think it sounds like it's sort of those two things have to work in tandem. I think organizations like ours and Hospice of the Piedmont and Hospice of Randolph have to be willing to say, we understand. We may not have an ability, we may not have had the same life or shared experience that you have had, but we have an ability to be empathetic to those same considerations. And we have tools in our toolkit that are, really important for people to be able to access, independent of cost,
Right.
independent of immigration status, independent of language proficiency.
Right.
Right.
Absolutely. 100%. And I'm so glad that you touched on the immigration point, because I'm working with families right now that when I ask, I'm like, how come you've never, asked for this? Or have you thought about X, Y, and Z, whatever the case was. And the number one thing is, well, I'm afraid that it's going to affect my legal status, or that immigration is going to be brought up, or that they're going to flag me, and then somehow, some way, someone's going to say something, and I'm like, healthcare has nothing to do with immigration, Homeland Security, nothing. They're like completely opposite, right? But even like that, they're like, well, I just don't, this is the rumor, and I'm like, it's a rumor, and it takes more than once to have that conversation. It's not until, and sometimes it takes more than one person, right? Like one of my constituents, it took 3 people for her to say, okay, I will go to this agency and, sign up for whatever the need that was needed, right? Because at the beginning, she kept shutting everybody off, even me. And I'm telling her, I'm like, listen, I know the legal process, or I know how this works. There was this such huge mistrust and fear, right? And I think, and often you hear in the news, and which it's the news right now, you're bombarded with so much information, but when you hear Latino community, or you hear, the Latino population or the Hispanic or whatever, you hear like, they're taking over our jobs, they're taking over our benefits, or they're taking this. I want to tell you right now, they're not. They don't have benefits. There are none. Okay. We're not taking over your jobs. We're not taking over benefits. If you are undocumented, you have no benefits. Okay. And so that is something that it's really sad when I hear people say like, oh, because this population is taking this. And I'm like, actually, no. All these people that are working construction in the fields, or whatever, the hard manual labor, they don't have benefits.
Right.
You get hurt, you're on your own.
Right.
You get fired, right?
I appreciate your sort of offering some of that clarification and dispelling some of those thoughts that we may have that are informed by a lot of different pieces of information or places that we may receive information. But we know a few things that are really true. For example, we know that Latinos are 50% more likely to develop diabetes, for example, or more pointedly, 50% of Latinos will develop diabetes in their lifetime, which we know is a precursor to heart disease.
Yes.
And which, to add on a little bit further down the road, which we know, because research tells us this, that patients with advanced heart disease suffer similarly to patients with advanced metastatic cancer. Mm-hmm. So, we're talking about a span of ages, I realize, but we're talking about a health issue that, absent of getting beyond their own cultural bias for themselves, or their own sort of thoughts and misinformation among the community that I can't access these services, that follows them throughout their entire life. And now we're focused on a much later trajectory in life, right? We're a hospice care organization. We're taking care of patients who have advanced chronic disease, oftentimes in the latter stages of their disease process. But if we're unable to reach the community further upstream, then how do we ever have the opportunity to begin to help alleviate their suffering once they get really sick and very debilitated. Because we know, regardless of your ethnicity, being a caregiver is incredibly burdensome.
Oh yeah.
It's really hard. And so how, it becomes really important. It is a community conversation. It's a conversation, I think, that has to happen between organizations like ours and individuals like us. And so I don't know if you have any additional commentary on that or not. I mean, it's a big
Yes.
problem, right?
It is. I mean, because if you think about it, and here's where like I'm working with the youth and I'm trying to guide that same mentality, right? Because they're seeing their parents like, oh, my parents don't go to the doctor, so I'm not going to the doctor, right? And they grow up with us. So I'm trying to be like, no, if something hurts, make sure you start taking care of it early, regardless of what your parents think, right? But then you fast forward, right? We go to now like where we're older, and we're talking kind of like we have chronic or you're kind of like at the end of your seasonal life, right? For a lack of better words. But the Latino community, we take care of our own. Like this is across the board. Like if your parents are aging and they're very old and they're perhaps they're sick or they have chronic illnesses, everybody says, I'm going to take care of my parents. They're going to live with me. They're going to be with me, right? This is one of those cultural kind of things where we say like, in this, you hear it like, oh, like in America, white people send their parents or dying parents to hospice or to, somewhere else to die by themselves, right? And we say like, we're never going to do that. That's not part of us. Our parents stay with us until they die, right? But what does that mean? That means that somebody always has to be at the house. That means that taking care of them, taking them to the doctor, making sure that they have their medicine, making sure that they have this, that, and the other. And not a burden, but like now you're taking care of everything. So how is your mental health, right? Are we even talking about what it means to take care of our aging parents, right? And then how do we break the myth? Like, I know when I met with you guys at first, it's not just hospice is not just for like dying people, to lack of better words, I don't want to say that, but and I'm sorry that I said it, but it's like offering that support, right, to the families that's fine. You want to take care of your parents, take care of them. But here's all these resources. You don't have to do it by yourself. It's educating, is making sure that they have the resources, that they know that there's support out there, that I don't have to do it on my own, right? That I can have somebody else and no one is going to judge me for it.
Yeah. So, it's interesting. The thought just occurred to me as you were talking through that. It's taking what could be an otherwise unmanageable situation that we know is complicated and difficult, because being a caregiver is hard, for all the reasons that you just cited. And that spans every ethnicity in our community, right? But it is how you take the unmanageable and with the right support, how you make it manageable, how you make it functional. And oftentimes for your own better health. And that includes a lot of things. That's your own mental well-being. That's your own social well-being. That's your own physical well-being. I mean, those are all, and even your spiritual well-being. I mean, those are all the dimensions of wellness that we touch, not just for patients who are in our service, but families who are caring for individuals who are on our service. And so I think that is a really important thing for us to begin thinking about and for us to begin talking about, because we realize, I don't think we can say this enough, as the largest growing segment of the US population, particularly a minority population, we know we have a responsibility as a healthcare organization, as a healthcare community, as a community period, to begin working beyond these barriers and in an effort to engender trust among these populations that we know that suffer greatly, maybe for reasons because they believe that it is the right thing to do, That, there are populations who believe that suffering is sort of the the spiritual path, right? That's a whole different conversation for a whole different day. But
right. And I think too, I think when we begin to have conversations like these and we start kind of getting out of our own reality, right? Because we don't know what we don't know, right? But when we're able to share stories, collective experiences, and and like I said, and we don't, without going into the political realm or anything, we don't have to, we can agree to disagree, but when it comes down to like when we want our community to thrive, regardless of whatever group you come from, right? Regardless of your ethnicity, your cultural group, it takes a village, right? If we want our, and I'm just going to talk for our area, High Point, right? There's this big movement of, High Point thriving, right? Well, how do we do that? We can't thrive if we're all working separate, right? We can't say like, well, my group, we're going to work on our own. And then that group is going to, no, like, I think we all have to come together and have conversations with one another, talk about what are the challenges, talk about the elephant in the room. Well, how can we remediate? How do we educate? And this goes even for, even Latino professional, is how do we now help each other understand, like using our voice to say, hey, let's partner up and let's have a conversation together in English and Spanish. Let's make it accessible.
Right.
What resources are out there? How can we bring, how are your services applicable to my group, or or how can I help your organization offer those resources?
Sure.
Right? Because there's still people that think that I don't need anything, I'm just going to work the way I am. But then when that patient comes in, talking about healthcare, and then they don't have the language, they don't have the resources, that now there's like barrier. That's another thing. Like when we know that there's like 10 barriers or 10 hoops that we need to jump, we just say it's not worth it. I'm just not even.
So, Giselle, I'm curious to know, and this is not to launch us into a whole different discussion. So just very briefly, we're coming up on almost a year of living in a global pandemic. We all know, because many of the people who are watching this today or listening to this later know and understand that COVID-19 has had a disparate effect on communities of color, Black and brown communities. Do you think that our now collective, almost year-long experience related to COVID has heightened the awareness of this conversation, or rather has heightened the awareness for the need of this conversation? And do you think that could be the beginning of something great? I have to think about the world sometimes as when there's a dark, ominous cloud, I always try to find a bit of a silver lining in every one. So is this potentially that has this really, difficult year that we've all lived through now, is a good part of that a heightened awareness of the necessity for these kinds of conversations and kinds of collaborations that we're embarking on now?
Oh yeah, big time. I think if nothing else, is shedding a light on the necessity to have these conversations. I read, I think the Charlotte Observer did an article not long ago, and it talked about how COVID-19, kind of like the article that you shared at the beginning, it shed a light that on the Latino population, we were like the largest, and as a matter of fact, I think there was a statistic, I want to say that it was, don't quote me, but I want to say that it was 40% of the deaths for COVID-19 came from Latino population. So it was somewhere, it was one of the largest. Don't quote me on the 40, but it was the largest out of everybody. Whites, Blacks, Hispanics had the greatest mortality rate too.
Right.
And again, it makes you say, why? Well, lack of healthcare. At the beginning, when the pandemic happened, nobody wanted to get tested, or they couldn't get tested because you needed an ID, or you needed this, or whatever the barrier was. you just couldn't access it, right?
Mhm.
Or then, a lot of the Latino population were the frontline workers, and some had the virus and couldn't take off of work,
Sure.
right? Or if they took off of work, now they lost 2, 3 weeks of work. Well, that's a paycheck, that's
Yeah.
money. Plus, now you have another hospital bill coming in.
Yeah.
And so, like, now I think that just kind of put a flashlight or like a bright beam light on the disparity. So now the need is here. Like, we need to talk about this. I'm not saying that, I'm going to resolve the issue right now, but it needs, like, the conversations need to happen that there is a disparity. There is, we have so many different layers to this
Right.
healthcare topic. So
Right.
then let's start talking about uncovering one by one, right? But then let's start bringing in people to have this conversation. Let's bring in people to educate, not just my community, but vice versa.
Sure.
The people that are looking at us, right? Because our headlines are always like Latino this, Latino that, Latino whatever. But are we having these conversations? Who's helping? Who can I go talk to about this?
Sure. Well, and you bring up an interesting point because the Latino population, the term Latino community, is really broad and incredibly encompassing,
Huge.
right? It's not just people from Mexico or it's people from Peru and Chile and Argentina and you know,
Colombia,
Colombia, Nicaragua. I
yeah.
mean, it's people.
Puerto Rico, like you
Yes.
have it's and Spain, let's not forget about Spain. Spain is across the pond over there, but
Yep.
they're also part, where we have this shared collective, belief, and Spain is a mother language, right?
Right.
And so it's not like Latino is a heavy loaded word, right?
Right.
We're not all alike. We have, and even with culturally, right? We share Spanish is the main language, but we have dialects, we have accents. My accent is very different from someone from, Peru or
Right.
from Venezuela or from
Right.
wherever, right? Like, and then even the way I was raised, and I'm not even talking about like if I was, in the city or if I grew up in the mountains, right? Like, there's just so many different layers to it, and I tell people it's kind of like the United States. If you grew up in New York, it's going to be way different than if you grew up in South Carolina, right? Like the North and the South culture. And then and very different if you're from California, right?
Yep.
And so just like that, Latinos, we're not all Mexican or whatever it is you think we're from. We have, there's a whole map of different countries, right? And shared collective experiences, but also very different experiences. We are raised differently, right?
Yep.
But we all love our, we're very fond of our culture, of our identity, of who we are, right? And so it's just it's it's a loaded word.
Yeah.
And I think it also helps that when, if you know somebody that's Latino, Hispanic, don't be afraid to ask, where are you from?
Sure.
Right? Now, don't do it, in a bad way, but
Sure.
it's okay to ask, like, where are you from? Where did you grow up?
Sure. And I have a great sense that shared sort of experience that you sort of talked about, although it's really different from country to country or region to region. I think we've talked about so many commonalities. Family tradition is very important. Caring for our own is very important. Understanding and working within our own community is really important. Um, you know, People who aren't in our community, who haven't belonged in our community, are often met with distrust, are often met with skepticism of, you know, are you really here to help me, right? Or are you here to judge me for some other reason, right? I mean, I think we've heard little bits and pieces of that sort of filtered through our conversation today. I'm so excited, Giselle, as we launch Hospice of the Piedmont, Hospice of Randolph, a partnership with you all, a collaboration with you all at the Latino Family Center to help begin to dispel so many of these sort of myths and misconceptions, because we know that people across every community, suffering is sort of this universal thing. living, aging, and dying are three things that are common to every ethnic group, whether you are in the majority or the minority, and whether you are white, brown, or African American or Black. It exists across every span of that. And so when we begin to rationalize and I think approach this from a very human perspective, as opposed to we're talking about dispelling myths and misconceptions about health disparities, particularly among minority populations, but we are all human.
Yeah.
Yeah. And our suffering is common.
Right. We all get headaches. We all get hurt. We all bleed red, right?
That's right.
Last time I checked, our blood color does not change,
Right.
depending on where you came from, right? We
That's
all
right.
have the same genetic compound, and so we are human. At the end of the day, it doesn't matter where you're from. It doesn't matter how you were raised. It doesn't matter your gender.
Yep.
We are all human. And this is, I think it comes to having equitable access to healthcare. Like I said it earlier that it's not about what can you give me for free or, what kind of, no, and I tell people in our countries, if you get sick, you go to the doctor, right? Or the doctor comes over to see you or whatever the case may be, right? It's not so taboo or so complicated.
Right.
Here in the United States. And I want to share, with our audience, like to me, like the American dream is very much alive. Like this is the land of opportunity. There's a reason why people keep coming here. It's not because, of whatever I don't know, whatever idea people are saying. The American dream is very much alive, right? If me, a little girl that came in with her parents and we all had one luggage and didn't know the language and we all just kind of came in blindly and said, you know what, my parents said, we're just going to go try it and see what happens. If we were able to break barriers and make something of ourselves, anybody can do it, right? We just have to have like that might and that power and that faith, right? That willingness to keep fighting, to move forward, right? And obviously for me as now in this role, like I want to inspire my youth, my immigrant population, but even my Latino that already went through all that.
Right.
Let's help each other out. It takes a village. Like we need to like I like this quote, like hand in hand together we can. Let's join hands, all of us. Like it doesn't matter where you come, white, brown, Black, let's all work together in this common goal to educate one another, to help, to make sure that we all make it, right? Life, we only have one life, right? We all bleed red. And and yes, we have all these cultural norms and layers and everything. But I think at the end of the day, if we can help people understand the importance of, let's talk about what's hurting, what's happening, have that conversation and articulate. I think that's going to go a long way, right?
Yeah. Well, one of the things that we talk about a lot in our own organization, and in fact, our mission is really pretty simple. It's to connect individuals and their families to the care they need on the terms they choose. And I think you articulated that very nicely. I think if I can offer that as just a summation, and that's sort of what we do. And I think that's really what you were describing. It's meeting people where they are and having an understanding. And that's really what we're doing today. Giselle, I want to ask you just one last thing. If there are one or two things that you really want, we've had a wonderful conversation today. I've enjoyed this so very much. But if there's one or two things that you really want people who are watching this today, watching it later, or listening to it, that you really want them to know or understand, what might that be?
One, we love very hard. Well, we take care of our family, but just like we take care of our family, like if somebody, and I tell people, the Latino community, we are going to embrace you as one of our own, right? I see it day in and day out. Don't be afraid to reach out, whether they speak the language or not, reach out, come go talk to them, extend a hand, tell them your name. Like I tell people that our community are, we as a collective whole, we love entirely. It doesn't matter where you're from, right? We're going to embrace you as one of our own. If you come to our house, we may not have much, but we're going to give you everything, right? And that's across the board. That's anybody, right? And so don't be afraid to reach out and to say like, hey, my name is Trent, like, what's your name? Even if you think Spanish and it's broken, you know what? They're not gonna judge you. They're probably gonna laugh at you. And then they're gonna say, I'm Giselle, nice to meet you. In
Sure.
their broken English, right? And so I think, to me, like, if there's one thing that I want whoever's listening is, don't be afraid to link arms, reach out, share your experience, don't, I think it's, have those conversations, whether you have the language or not, doesn't matter, share. I say that food brings people to the table. It doesn't matter where you're from. And when you break bread with someone, you understand culture at a whole different level, right?
Totally.
And so to me, like, break bread together, like, have conversations, the understanding, talk about the hard things or the easy things. They
Sure.
don't know the language. Hey, be like, do you want to practice English? I'll 30 minutes a day. It doesn't matter. There's little things that you can do to build trust. And in turn, then if there's ever a need, they might say like, hey, something is hurting. Is this normal? Right.
Mhm.
And there's your leeway, like, oh, I know a doctor or I know a place that can help you. Right.
Right.
So, those are my words of wisdom. And so, but it's, yeah, I'll
I
stop talking.
appreciate it. I think to put it in just a short phrase, I see we've been rejoined by our host, Ryan Biagini, but to put it very succinctly, I think what you've described is beginning a common understanding. Um, and I think we're beginning to do that today. And I so appreciate the time that I've spent with you. As I mentioned, I see Ryan has rejoined us here, so it must mean our time is up. I think, Giselle, you and I could continue this conversation for a very long time. This has been fascinating. So thank you very much. And I'll turn it back over to Ryan.
Yes, thank you, Giselle. And before I wrap us up, there is one kind of comment in the chat section that I thought I'd just read aloud because I really think it's a great summation of this conversation. It says, seeing Giselle address the Latino community's issues with such enthusiasm and Trent being so receptive to her descriptions, it is certain that the Latino community has better opportunities to improve their day-to-day lives.
Wow.
And I think that's a great, encapsulation of this conversation. So thank you both for allowing us to sit in on the conversation. Giselle, your work and that of the YWCA Latino Family Center are doing great things for the Latino population in our community. Thank you for unpacking your knowledge and many years of shared experiences within the Latino community. You offer personal and professional assistance, connection to community resources, and a safe space to find not only practical support, but a listening, empathetic ear. So thank you. And thank you for shedding light today on how health disparities affect the Latino community and the power of building trust and sharing one's own story, encountering those challenges. As Trent said, we look forward to working with you and the Latino Family Center more in the near future to help to continue to dispel these cultural myths and misconceptions about healthcare, and in particular at end of life that you referred to during this conversation. I'd also like to thank all of our listeners who have joined us today for our discussion exploring our community, identifying health disparities. As we continue this e-series, we are pleased to inform you that both this series as well as all of our future e-series installments are available on podcasts for download at both our website under resources and on SoundCloud, Google, and Apple Podcasts. We hope you will tune in next time as we continue this conversation and welcome our special guest, Curtis Holloman, the new Executive Director of the Foundation for a Healthy High Point, for a conversation exploring our community, distilling health disparities. Together, Trent and Curtis will continue this informative and impactful series of conversations regarding health inequities, discussing how community-based support can help create solutions to help the health disparities and help facilitate upstream change. We hope you will join us. But until then, I'm Ryan Biagini, and this has been the E-Series.